Hello, Capstone classmates. So my name is Morgan Wise, and I decided to do my capstone final project on trauma-focused cognitive behavioral therapy, or TF-CBT. And I ultimately chose this topic for my project because I've worked in a variety of different settings, including a domestic violence shelter back home for a couple years, doing work with survivors of domestic violence and sexual assault. I worked inside the shelter using the 24-hour crisis hotline, and then, or I guess not using, but answering, and then also did sexual assault response advocacy. So I was going with survivors of sexual assault to the local hospital and working with them, advocating on their behalf while they met with a nurse examiner practitioner to have the exam performed, and then I would kind of advocate on their behalf following that exam, kind of going into like the legal side of it, courts, pressing charges, different things like that, releasing the kit. And so anyways, now that I've finished my bachelor's and moved here to finish my master's, I have been working in foster care, and I've just been exposed to a lot of different trauma-related incidents. And one thing that I just hadn't ever gotten a chance to learn about was different therapies that can be utilized with, or different kind of strategies that can be utilized in terms of a child or an adolescent, an adult, young adult in this sense, through the use of therapy, kind of helping them through their experience. So when Professor had said that he had wanted us to kind of choose something that we wanted to know a little bit more about, I ultimately decided to choose trauma-focused cognitive behavioral therapy. And so I kind of started this little Padlet and uploaded just different kind of things that I wanted to touch on. And so to begin, I wanted to upload the How Childhood Trauma Affects Health Across a Lifetime by Nadine Burke-Harris. I'm sure some of us have seen this, but it just really goes to explain how significant trauma is, and especially across a lifetime, the span of an entire lifetime, how it can affect, even just significant, severe, consistent trauma can lead to a 20-year life expectancy difference for those who have experienced it, as opposed to those who haven't experienced severe trauma. So I thought that was extremely important, and just the different kind of, I won't play the video, but just the different aspects that it touches on, such as like heart disease and different cancers, and how doctors, at least until this video was created, I know some are much better about it now, but just haven't really touched on the idea of trauma. Instead, they just see a kiddo who's hyperactive, so ADHD or ADD, and here's Ritalin, as opposed to kind of how else we can address those symptomatic behaviors. So digging a little bit deeper into trauma-focused CBT, TF-CBT is an evidence-based treatment model designed to assist children, adolescents, and their families in overcoming the negative effects associated with the traumatic experience. And diving a little bit farther into my current field experience, I was with CPS in the beginning of this year. I'm in the advanced standing program, and now I'm with the Boys and Girls Club. CPS ended up going virtual, and it was very hard to get hours. So now I'm with the Boys and Girls Club and working within the after-school program with kiddos that are in kind of the inner city of Grand Rapids, and most of them do have kind of some concerning behaviors, some significant needs, some experiences with trauma. So, and my supervisor there actually did TF-CBT at DA Blodgett St. John's, the foster care agency. So it was super interesting to kind of get her input on all of this, and definitely another reason why I wanted to dig deeper into it, because she always had great strategies to kind of help me through meeting with youth and whatnot based off of her experience and work with TF-CBT. So some different trauma types that TF-CBT can kind of work with is sexual abuse, domestic violence, traumatic grief, disaster, terrorism, or multiple or complex traumas. The goals of treatment with trauma-focused CBT is to help survivors of trauma address and resolve the distress resulting from the events, ultimately decrease negative behavior patterns and emotional responses often developed as a result of the trauma. So kind of like a cultural from like a cultural aspect, TF-CBT has been modified to address the needs of Latino, Native American, deaf, and hearing impaired military and many international populations. I thought that was kind of an important thing to touch on. It's not just the typical white, Caucasian, female or male, but a pretty significant variety of individuals. And so the length of treatment is about 12 to 25 sessions, which are about 60 to 90 minutes each, divided equally among youth and the parent or caregiver. Kind of going off of that, so the idea of TF-CBT is not just the individual who has experienced the trauma themselves, but also their parent or caregiver, and I'll dive a little bit deeper into that. But going off of that, so some key components involve establishing a therapeutic relationship with youth and parents, and through the use of gradual exposure throughout treatment. So I wanted to magnify this a little bit. So this is something that I got from my supervisor. She was explaining this is kind of how she went about exploring the idea of TF-CBT with clients, kind of breaking it down into the different steps. So they use the acronym or the abbreviation of practice. So the P stands for psychoeducation and parenting. Again, going off of that kind of like parent or caregiver aspect. So psychoeducation about childhood trauma and PTSD, the parenting component, including parent management skills. The R for relaxation skills individualized to the child, client, and parent. So identifying some different relaxation skills and ensuring that those are implemented in both therapy and at home. The affect modulation skills adapted to the child, family, and culture. Cognitive coping, so connecting thoughts, feelings, and behaviors related to the trauma. Trauma narrative, assisting the child in sharing a verbal, written, or artistic narrative about the traumas related experiences, so including cognitive and affective processing of the trauma experience. And then there is in vivo exposure, which I found to be the most interesting to kind of learn about, as it seems to be kind of like the core of TF-CBT, but it's just a mastery of trauma reminders, which I'll explore a little bit further in a moment. And then the C for conjoint parent-child sessions, practice skills and enhance trauma-related discussions. So bringing in that kind of psychoeducation and the different cognitive coping skills, and implementing those in a conjoint parent-child session to kind of explore and demonstrate how these different coping skills and mechanisms can be utilized and should be utilized. And then the last one, E, enhancing safety and development. So enhancing future personal safety and optimal developmental trajectory by providing safety planning and social skills training. So kind of to wrap up the idea of TF-CBT while working with a client is ensuring that once these, like I said, 12 to 25 sessions are over, or, once this therapy has wrapped up, ensuring that we don't just forget about it, that we're still enhancing the safety and the development that can go from days, weeks, months, years beyond the treatment. So in vivo exposure, to explore that a little bit further, in vivo exposure involves confronting situations in a therapeutic manner that clients have been avoiding because they are fearful of them or they are reminders of the event. So I know that a couple different things that I'd kind of looked into was the idea of someone who had experienced a traumatic event that involved being bit by a dog and having to undergo multiple surgeries. And so the thought of, or the sight of a dog or the sound of a dog is absolutely terrifying to them. It sends them into this extreme spiral that has to do with, sweating, horrible thoughts, shakiness, racing heart, severe anxiety. And so through in vivo exposure, it's kind of step by step exposing them to beginning the thought of a dog, being around a dog, being slowly but surely, step by step, day by day, week by week, kind of grasping the ability to be able to be around that dog again. And so first explaining that trauma-related fears are sometimes unrealistic or excessive, and the estimates of danger increase after a traumatic event. So again, everyone might be a little bit afraid of being bit by a dog, especially kiddos and whatnot, parents being fearful a dog will bite them in the face if they're in their face. But after a traumatic event, that anxiety, that fear is just exacerbated. And then, like I had said, by repeatedly putting a client in a realistically safe situations and an emphasis on the realistically safe situations over and over, staying in it long enough for the anxiety to decrease, the in vivo exposure will block the negative reinforcement. And then I just kind of wanted to wrap up with, I was looking for different ways to implement the CBT with kiddos, with clients in a way that's interesting. And so I came across CBT baseball, which I come from a baseball family. So I thought this was super interesting, but also just to show others that there are many different ways that you can implement games and stuff when it comes to CBT. So for this particular game, you would cut out 4 bases and set them up as a baseball field would look, or softball field. And then the therapist or the counselor would write scenarios on pieces of paper, crumble them into balls. So you would have youth stand at the plate, and then the therapist or the counselor is considered the pitcher and will toss the child a ball which is one of the balled up papers with the scenario on it. So the child's going to run to first base after reading the scenario, and they're going to state their initial thoughts to the scenario that they just read. So first base is going to be thoughts. Once they have finished, they will run to second base and state their initial feelings related to that scenario or event that was on the piece of paper. They're going to then run to third, and they're going to identify actions that they would take. The initial, like, what actions would you take when presented with this scenario, or, when you were in this situation. And so then, depending on the responses, if they are appropriate, the youth are going to be able to run home and they are considered safe. If the responses are inappropriate, the therapist is going to yell, "You're out," as youth approach the plate. And so a lot of times in the very beginning, they're going to state some kind of initial thoughts, reactions, or feelings that are not going to be the most appropriate. So just kind of like the first few times each child has gone through, like, probably going to have kind of the fun, like, interacting, "You're out." But as you kind of go through and work through, they're going to be they're going to be considered safe. So again, just going to continue going through these scenarios until the youth are aware of the appropriate actions that they should be taking when they find themselves in these situations. So not a ton, because I didn't want to bore anyone on TF-CBT. I know I can get very in-depth with different articles and different specifics, but I just wanted to, I know that a majority of us working in the social work field are going to encounter individuals who have experienced a great deal of trauma. And so I just wanted to kind of shine light on, even if we're not actual licensed therapists, but just being able to take some of these concepts into the classroom, or into a jail setting, or again, into like foster care. I'm just a worker, but I can still kind of utilize these different techniques and explain how, thoughts, behaviors, and beliefs can really entirely impact those behaviors, the consequences, kind of the way we react. So again, just wanted to shine some light on trauma-focused cognitive behavioral therapy, and I hope everyone learned a little bit of something.